1. Overview. This presentation should not be considered medical advice. It is simply educational information about the science of chronic fatigue syndrome or CFS. Always talk to your doctor before making any significant lifestyle changes, and do not change medication or treatment without first discussing with your doctor. Recovery is possible, even for the most severely affected. Many bed-bound and severely affected patients have made partial or full recoveries. Recovery does take time and effort, and the results are not guaranteed. However, you are likely to make significant improvements to your health and quality of life. Even though we discuss stress as a causal factor in CFS, it does not mean that the illness is your fault. The effects of stress on the brain are mostly beyond our conscious control, and may have evolved as a protection mechanism. Try not to blame yourself if you experience difficulties in recovering. Throughout this presentation we use the term CFS rather than myalgic encephalomyelitis, or ME, to describe the illness. We are talking about a severe illness with real physical symptoms, not an imaginary illness, or purely fatigue and depression. The term ME fell out of favor in the 1990s because it implies an incorrect etiology. Even the person who coined the term ME, Sir Donald Acheson, acknowledged that ME does not always cause muscle pain and that it may not involve inflammation of the nervous system. Although CFS is associated with inflammatory cytokines, there is generally no actual inflammation, and the cytokines are probably caused either by dysfunction of the immune system, or due to stress. Many patients prefer the term ME, as it implies a more serious illness. 2. Checklist. Before attempting to recover from CFS, you should first make sure that you do in fact have CFS rather than another illness. Make sure your doctor has performed the standard blood and urine tests to rule out other illnesses that could be causing your symptoms, such as anemia, diabetes, mononucleosis, or sleep apnea. Typically, CFS causes symptoms such as fatigue and muscle pain, especially after physical or mental exertion. However, not all patients experience pain. Other common symptoms include insomnia, hypersensitivity to light and sound, irritable bowel syndrome, dizziness and vertigo. Lyme disease can cause similar symptoms to CFS, but make sure you go to a good doctor. Many so-called Lyme literate doctors tend to diagnose everyone with Lyme, and will use unvalidated tests. Ensure that you are open to psychological factors as causing your CFS, or making it worse. This does not mean that your symptoms are imaginary or mild, or that you're crazy. 3. What to expect. Recovery tends to be slow and gradual, and you may occasionally feel worse before you get better. CFS seems to be caused by long-term changes in the brain's structure and wiring, and it takes time to reverse these changes. How long will it take to recover? Each patient is different, but typically it will take from 1 month for mild CFS, up to a year or longer for severe cases. Full recovery to 100% health is very possible. Many moderately and severely affected CFS patients have fully recovered, including bed-bound patients, and many more have made significant improvements. After recovering, it is important to be careful to avoid long-term chronic stress. This doesn't mean you have to live your life in a bubble. You can certainly lead a normal life with short-term stresses. You just need to be careful to avoid the long-term chronic stresses that tend to trigger CFS in the first place. 4. Psychosomatic illness. The word psychosomatic comes from psyche plus body, meaning physical symptoms caused by psychological factors. The symptoms are very real and not imaginary, or hypochondria, or made up, and patients are not malingering. Everyone has psychosomatic symptoms. heart rate, bowel movements and the immune system are all significantly affected by psychological stress, and this happens to everyone. Top athletes are all affected by psychosomatic fatigue during and after each event, and it seems to be the main limit to athletic performance. This will be discussed further in a later section. Brain regions that are involved in psychosomatic symptoms include the HPA axis, prefrontal cortex, central governor and autonomic nervous system. Psychosomatic and stress-related symptoms do not just happen to humans. Experiments in rats and mice demonstrate psychosomatic symptoms after restraint stress and other psychological stresses, including similar suppression of the HPA axis to that seen in CFS patients. It is perhaps better to use the word functional rather than psychosomatic, as physical and viral stresses have similar effects on the body's stress system. 5. Examples of stress-causing physical symptoms. Studies on people taking exams show significantly higher Epstein-Barr antibody levels, indicating reactivation of dormant infection. Epstein-Barr is the same virus that causes mononucleosis, which is also known to cause CFS. The symptoms usually last a few weeks to a month. However, the virus is never fully cleared from the body, and it reactivates when the body is under any stress. Animal studies show that psychological stresses trigger the release of inflammatory cytokines from the brain cortex. It seems that the brain responds to both psychological, viral and other physical stresses in a similar way, by releasing inflammatory cytokines. These are the same immune-modulating proteins that are released during an infection, and they have a number of effects on the brain and the body, including modulating the immune system. They also affect the brain, causing pain, fatigue, depression and anxiety, the so-called sickness behavior. Studies on humans show that even something as apparently minor as a lack of social support can result in an increase in inflammatory cytokines. This may be one factor that causes the negative feedback loop in CFS, if patients do not have supportive family and doctors. Animal studies show that psychological but not physical stresses cause suppression of the HPA axis. Although physical stresses have similar effects in causing activation of the stress system, it appears that psychological stresses which cannot be overcome may additionally cause suppression of the stress response, perhaps to conserve energy. Sympathetic nervous system arousal causes an increase in bowel movement and a decrease in stomach emptying and digestion, as well as a shift towards pro-inflammatory cytokines. The HPA axis has similar effects, and it is normally activated alongside the sympathetic nervous system. 6. Hypothalamic pituitary adrenal axis. The HPA axis is the main stress system in the body, controlling adrenal hormones such as cortisol. Short-term stress immediately activates the sympathetic nervous system, the so-called fight-or-flight response, caused by the brain activating sympathetic nerves. The HPA axis is a longer-lasting stress response, and provides more energy for a longer period of time through the release of hormones such as cortisol from the adrenal gland. The HPA axis influences many systems within the body, such as energy metabolism, digestion, autonomic nervous system, the immune system, and sleep. Stress causes increased activation of the HPA axis, whereas burnout and CFS are associated with reduced HPA axis activation. Chronic long-term stress and the cessation of long-term stress are also associated with reduced HPA axis function. Animal experiments show that negative psychological stress suppresses the HPA axis. Normally cortisol rises in the 30 minutes after awakening, similar to a stressor. However, CFS patients tend to have lower cortisol awakening response, reduced HPA axis activation in response to stress, and flattened circadian cortisol rhythm. Overall, there is reduced HPA-axis drive in CFS and burnout. 2 studies have shown that the HPA-axis dysfunction in CFS tends to improve after treatment. Normally, the HPA-axis and sympathetic nervous system work together, with activation of one causing activation of the other. However, with CFS, the autonomic nervous system and HPA-axis become decoupled, with excessive sympathetic arousal after minor stress. Normally, the parasympathetic nervous system is activated after stress and when resting. But in CFS, there is a tendency towards more sympathetic nervous system activation and less parasympathetic activation, which then results in feelings of anxiety and being stressed out, and impaired digestion and immunity. 7. Burnout. Burnout is caused by long-term chronic stress, or the cessation of stress in the period after long-term stress has ended. Research shows that stress and burnout are separate variables, and that burnout can exist even in the absence of stress. Burnout is associated with mental and physical fatigue, muscle pain, anxiety, depression, headaches, sleeplessness, reduced HPA-axis activation and low cortisol. Psychological symptoms of burnout include depersonalization, or the feeling that things are not real, and loss of feelings of accomplishment. It tends to make people easy to anger, and they tend to feel they aren't accomplishing as much. Occupational burnout is caused by excessive demands and insufficient support and resources. Burnout tends to resolve once the workplace stresses are resolved, or when more resources are put into place to help deal with the stresses. However, burnout may turn into CFS if the stress is not resolved, or if the CFS itself turns into a stressor. CFS can be thought of as persistent burnout which does not resolve after the stresses are removed. 8. The central governor. The central governor is the part of the brain which generates sensations of fatigue, weakness and pain. It protects the body against damage by curtailing physical activity before damage occurs. Research shows that the central governor generates fatigue long before the muscles reach the maximum capacity. Athletes can override the central governor, but it is very difficult. Fatigue is an emotion, albeit one that is hard to ignore and difficult to override. The brain regions associated with the central governor include the anterior cingulate cortex and the insular cortex. These are involved in emotional memories, autonomic regulation, motor control and homeostasis. Various physical and psychological factors cause fatigue in athletes, such as rate of heat accumulation, hydration, knowledge of the end of the race, emotional state and the amount of sleep. For top athletes who have similar physical performance, psychological factors are most important in determining who wins a race. Athletes are able to train their central governor to allow them to override the fatigue, but this can sometimes result in death or injury. Persistently overriding the central governor may lead to overtraining syndrome or CFS. The same brain regions that are involved in the central governor have been shown to be abnormally activated in CFS. Research shows that even in animals, these brain regions are responsible for performing an unconscious cost-benefit analysis, which either results in goal-directed behavior or fatigue. This is part of the dopaminergic system, which regulates activities, goals and rewards. 9. Causes of CFS. Psychological stress seems to be the main cause of CFS, with 85% of patients reporting stressful life events in the year before their illness, compared to 6% of controls. Studies looking at mononucleosis patients have found that 22% have fatigue 6 months later, and 9% have CFS. Factors that cause post-viral CFS after mononucleosis and other viral infections include too much bed rest, trying to do too much too early, and having a boom-bust cycle, believing that the illness will take a long time to recover from, and pre-illness fatigue and distress. Although 72% of CFS patients report an apparent viral infection, a definite infection is only found in 7% of patients. What appears to be a flu-like infection may in fact be acute CFS or burnout due to stress, as the signs and symptoms are similar. Studies show that infections and psychological stresses have similar effects on the HPA axis, and that viral infections are physiologically stressful. The brain doesn't care whether a stressor is physical or psychological. Our brains have evolved to treat both types of stressor in similar ways. In many cases, CFS is triggered by excessive physical training. As discussed earlier, athletes are susceptible to overtraining when they do too much training for too long with too little rest. Research by Professor Tim Noakes has looked at the so-called central governor in the brain. This part of the brain is responsible for integrating a number of physical and psychological factors, such as distance to the finish line, emotional state, sleep status, hydration, and rate of heat accumulation when determining when to generate fatigue. Central fatigue seems to be an emotion, as it is generated in the emotional center of the brain, but unlike other emotions, it is very difficult to overcome and ignore. The parts of the brain responsible for central fatigue appear to have abnormal activation in CFS. Long-term sleep deprivation is another cause of CFS. Insomnia can also be a symptom of CFS, and can make other CFS symptoms worse. Studies show that dealing with sleep issues goes a long way towards helping CFS patients to improve. In many cases, the illness itself can cause negative feedback, due to the symptoms causing anxiety and depression, which then causes further burnout and CFS. Negative emotions such as anger, fear, worry, guilt, hopelessness, and resentment can be a factor in causing or perpetuating CFS. 10. Etiology of CFS. The initial trigger for CFS seems to be long-term chronic stress, which can be either psychological or viral, or a combination of both. The symptoms seem to be created through the central governor and the HPA axis, which interact with the motor cortex, the immune system, nervous system, and digestive system. Attempts to push through the fatigue cause increased symptoms, resulting in further illness. Eventually, the symptoms themselves cause negative stress, resulting in a vicious circle. 11. Evolutionary reasons for CFS. CFS appears to be the brain's response to negative stress. Researchers suggest that burnout and CFS may be a protection mechanism that has evolved to protect the body against the effects of chronic negative stress, which is impossible to overcome. Depression, fatigue, and pain may have evolved to guide behavior away from the negative, stressful activity. Unfortunately, humans try to push through negative stress and adversity, ignoring the signals from the brain, which may result in burnout and CFS. CFS appears to be the maladaptive end result of continually pushing through the fatigue and other symptoms from chronic stress. 12. Chronic pain. Chronic pain appears to be an echo or memory of previous pain which persists long after the actual injury, and sometimes in the absence of physical injury. Pain is processed in the emotional part of the brain, and emotions can actually generate real pain that is identical to physical pain. Anxiety, stress, and expectation can cause pain to persist long after injury. Muscle tension can also generate physical muscle pain. Like fatigue, pain appears to be a protection mechanism that has evolved to protect us from injury. Pushing through the pain too much is generally not recommended, as it may in fact make the chronic pain worse. 13. Irritable bowel syndrome. IBS is the diagnosis given to the presence of stomach pain, constipation or diarrhea that is relieved by a bowel movement, and which is not caused by any other condition. IBS is termed IBSD or IBSC depending on whether diarrhea or constipation is predominant. The gut has its own nervous system called the enteric nervous system. Although it is a self-contained nervous system, it can be significantly influenced by the HPA axis and the autonomic nervous system. The acute stress response results in the release of CRH from the brain as part of the HPA axis activation, as well as sympathetic nervous system arousal. Both of these cause an increase in bowel movement. Cortisol, which is released by the adrenal glands during HPA axis activation, causes increased absorption by the colon. Acute stress is therefore likely to cause diarrhea because it results in CRH and sympathetic nervous arousal, which results in increased bowel motility. Long-term stress without burnout results in high cortisol levels, resulting in high absorption, which may result in dry stools and constipation. Burnout and CFS associated with reduced HPA axis drive and low cortisol may result in sluggish bowel movement and low absorption, causing a combination of constipation and diarrhea due to loose stools moving slowly through the colon. Research shows that both CFS and IBS are associated with dysbiosis, or abnormal bacteria in the colon. This may be caused by a combination of abnormal gut motility, as well as the effects of stress on the bacteria in the gut. 14. CFS treatments. The only treatments with any proof of effectiveness in treating CFS are graded exercise therapy and cognitive behavioral therapy. Multiple studies show that graded exercise is moderately beneficial overall. However, patient surveys find it is mostly detrimental. Fred Friedberg found that replacing stressful activities with non-stressful activities resulted in improvement, even though there was no overall increase in physical activity. It seems that reducing stress was more important than simply increasing activity. It is important to recognize that stress is a major factor in CFS, and that increasing exercise may be detrimental if the stresses are not addressed, or if the exercise itself is perceived as stressful. Effective rehabilitation programs recognize that increasing exercise is not always the answer, and sometimes it is actually necessary to reduce activity levels. Most important is to avoid the boom and bust cycle. Don't do too little or too much. Studies into cognitive behavioral therapy also show overall moderate benefit, but again patient surveys find it mainly detrimental. Certain versions of CBT, such as the PACE trial, are based on the unproven theory that fear of exercise is causing symptoms. While this may be a factor for some patients, it doesn't appear to be central to the etiology of CFS. CBT may be beneficial to some patients by helping to deal with stress and anxiety, or in dealing with previous trauma. 15. Recovery. The first step in recovering is to remove all negative stress. This may involve making significant changes to your life. Gradually increase positive activities, both physical and mental, but be careful to not do too much. Ideally, these activities should involve working towards positive, motivating goals. Having a daily structure or routine to your activities may be helpful. The key to recovery is building your life back up again, and training your brain that there is no need for a negative stress response to non-stressful everyday activities. Above all, avoid the so-called boom-bust cycle of doing too much followed by relapsing. Negative emotions such as guilt, anger, fear, worry, hopelessness and resentment can be particularly damaging. These feelings may be due to external stresses, or to the illness itself. Try to avoid all negative emotions, and deal with any problems as soon as possible rather than having an emotional response. Make sure you are in control of your life and your recovery. Lack of control is a major factor in causing burnout from stress. Having sufficient social support is important. Lack of support is one of the main factors causing burnout, the other being excessive demands. Lack of social support has been shown to cause the release of inflammatory cytokines from the brain. Doing flow activities has been shown to reduce burnout. These are activities that you are completely immersed in, which make you feel energized and fully involved. People describe flow activities as being in the zone, or zen-like, or feeling truly alive. Working on creative pursuits is also helpful in reversing burnout. Try to have multiple enjoyable short and long-term goals that you are working towards. Try to have a purpose in life, and work towards that purpose every day. Poor sleep can cause a vicious circle in CFS, and it is important to address as part of treatment. If necessary, use a therapist or counselor who is familiar with CFS. Therapy can be a combination of physical and psychological. Many CFS patient forums and support groups have a negative view of the illness and perpetuate the belief that it is impossible to recover and that psychological factors are not important in causing the illness. This can cause a negative outlook and can foster the belief that recovery is impossible. There are many stories of recovered patients, and most recovered patients are happy to discuss what worked for them. Talking to other recovered patients will give you a better idea of what works and what doesn't, and will give you a more positive outlook. 16. Final thoughts and summary. The key to recovery is to work gradually at reducing stress and increasing positive goals. Don't push too hard, and don't blame yourself for your illness. Recovery is gradual and takes time, but is possible. For more detailed scientific information and references, see the mindbodyhealth.net website.